Pathogenicity of Mycobacterium Tuberculosis 5 Mark Patho 2. Here is the complete and well organized answer. Pathogenicity of Mycobacterium tuberculosis as per the BHMS second year pathology 2 syllabus including all relative headings. Pathogenesis of Mycobacterium tuberculosis. Introduction. Mycobacterium tuberculosis is a slow growing acid fast bacillus. It is a causative agent of tuberculosis TB which primarily affect the lung but can also affect the organs. It was discovered by Robert Koch in 1882. Morphology. Slender rod-shaped bacilli, acid-fast due to high myocholic acid content in the cell wall. Non-motile, non-sporing, aerobic. Sources of infection. Human and the man reservoir. The infection spread through inhalation of airborne droplet through infected individual. Mode of transmission. Droplet infection, coughing, sneezing, talking, less commonly via contaminated milk from Mycobacterium provis. Pathogenesis step up disease development. Entry bacilli enter lung via inhalation. Alveolar macrophage uptake bacilli are phagocytosis by macrophage but resist the destruction. Intracellular multiplication. Bacilli multiply inside the macrophage. Granuloma formation. Host immune response leads to formation of tubercle granuloma. Cessation necrosis. Central necrosis occur in granuloma due to immune response. Cavitation spread. Tissue destruction may be cavity, lung, bacilli and spread via lymphatic system to the lymph node. Bloodstream causing miliary TB. Boschi spread to other lung area. Virulence factor. Crowd factor. Toxic inhibit neutrophil migration and causing granuloma formation. In sulfitide inhibit phagosome lysosomy fusion. Lipoarbenoma LAM suppress T cell proliferation. Mycolytic acid resists desiccation of host defense. Host factor immunity. Cell mediated CMI key defense T cell macrophage activation. Hypersensitivity reaction 4 lead to tissue destruction. Poor nutrition immunosuppressive. Example HIV. Genetic factor increase susceptibility. Clinical manifestation primary TB. Gone focus, gone complex, usually asymptomatic or mild symptom. Secondary TB. Reactivation of latent infection more severe with cavitation. Symptom cog, hemoptysis, fever, night sweating, weight loss. Miliary TB. Disseminated for affecting multiple organ. Laboratory diagnosis briefly to the supported pathogenesis. Sputum examination, Zell's nasal stain, showcase acid-fast bacilli. Culture, lower strain, Jason medium. Montag test, delay hypersensitivity reaction. PCR detect bacterial DNA. Conclusion. Pathogenicity of tuberculosis depend on the ability to avoid the host immune system, serve inside macrophage and include chronic granulomatous inflammation. Understanding its pathogenesis is crucial for diagnosis, treatment and prevention.